Hey everybody, it's Mike Mackniak here. Welcome back to another episode of This Is What It Takes podcast. Of course, I am here with my partner and better half, I guess, in this regard, Victoria Cuore. And we have a very special guest who is one of my good old friends,
Hmm.
Rebecca
Sure.
Antoni, attorney extraordinaire and really good longtime friend of mine, lifetime friend of mine. Listen, in the world of human services, very complex world where we're dealing with human services and invariably, especially Rebecca, as she's known now professionally, and I get involved with family advocacy. We've spent a lot of our energy documenting the failures of the systems and the cracks that families fall through every single day and whatnot. And that's pretty much what I do on my Holding It Together podcast, kinda. But today I'm joined by these two powerhouse women and two of my favorite people because they've both navigated the grueling reality of raising special needs kids while maintaining their careers, their families, and the semblance of a life for themselves. I mean, you guys know Victoria Cuore is my host and partner on this podcast. And as I said, Rebecca comes here as well with just a wealth of experience and strategies and ways that the law can help and the way that they have helped themselves and their families. And they have this profound expertise because they are quietly doing the work that they talk about in their own lives, which is just the most impressive part of everything. So today we're not going to talk about policy. We're not going to talk about flaws in laws. We're going to talk about the grit and the guilt and the hard-won workarounds that allow caregivers like these wonderful people to keep moving forward when the weight of the world feels like it's unsustainable. So the way that I want to open up with this is for each of these beautiful women to give you all a taste of their caregiving life and how they came into it. And I guess, Victoria, we'll start with you. Tell us about your situation. I mean, most people that are listening probably know most of it already, but just for those who have never met you before or have never seen or heard you speak, tell a little bit about how you came to be here and why we're partners. And well, not that's another day. We don't care why we're partners. We care about why you're here. I care about your caregiving journey and the, sorry to say, unfortunate events that brought that to be. So go for it.
Well, thank you. And welcome, Rebecca. I'm glad you're here. And well, I survived domestic violence and it occurred while I was pregnant. And I made a deal with the devil. I said that as long as he didn't hit my stomach, I wouldn't fight back because when you get punched in the middle of the night to tell you to get up and go get him something to drink, you know you can't de-escalate that situation at that moment. And I did get out and I survived and I was put into the hospital and the ICU and the ER and everything more times than I can count. And the last time I was in the ICU, they told me I had a 2% chance of survival and that if I made it through the night, it would be a miracle. 8 days, they tried to stop the labor and contractions because she was too early. And then finally, we ended up going in for an emergency C-section where we both coded and they life flighted my daughter to a children's hospital an hour and a half away. And I know Rebecca can say that this is a mom, but when you're laying there and I never even got to hold her, and I literally watched them run her down the hall in an incubator, and I hear a helicopter taking off. My heart was in that helicopter, and I felt like every part of me was dying at that moment. And once I got out of the ICU, I was in a wheelchair, and I stayed in the NICU with her, just a few days shy of 6 months. And we were coding every single day. We had epilepsy. We were having seizures left, right, and center. When I finally got to her, the first day I got to her, they held the OR so that I could see her, and they were going to wheel me down while I could hold her for the first time. And she had mandibular distractions, which are metal rods put behind the ears where you crank them with a device twice a day and it brings your jaw out because she didn't have an airway and she looked like she didn't have a bottom jaw, and it's Pierre-Robin syndrome. And so we ended up doing that. And then they drilled holes in her nasal passage and gave her nasal stents at just a few days old. And then this continued, the coding continued down the road as it continued. We ended up having to do a tracheostomy, which she had. They thought she'd have it till at least middle school. By the grace of God and lots of prayers, she had it until she was 2.5. She had a feeding tube because she couldn't take anything by mouth. And so everything to sustain life was done through a feeding tube. So we had the G tube, we had the GJ tube, which is fed through the jejunum. When I went anywhere, and I know Rebecca knows this, you have a pulse oximeter, you have the apnea belt, you have the emergency kit. I had oxygen. She was on CPAP. You had your emergency trach bag. I had also the feeding bag. And there was 11 pieces of equipment that, including all the bags and stuff that had to go with me everywhere I went. And if she had an occlusion in her trach, you have to do an emergent trach change, and you had to keep saline, and you had to keep everything clean so there wasn't a stoma infection. And all of these were, things that were going on. And we were going to 25 doctors and therapies a week. And in between that, we're implementing in what we learned at those therapies. And it was literally a 24-hour a day responsibility. And they would say to me, it's okay for you to grieve the child that you didn't have. And I didn't see that way. I saw it as she's here and she survived and she's amazing. And I'm going to celebrate every minute of life, even when we were in medically induced comas. And I I did. And so, we've had well over a counted of over 100 ER visits, 54 surgeries to date. 2 years, 2.5 years ago, I almost lost her. She went into complete organ failure, and they told me we'll keep her comfortable and let her pass overnight. And that was not even an option. She ended up in on every kind of machine you can imagine, including, I mean, full life support and kidney failure. She was at stage 4. I started the process to do kidney donation. Dialysis was in the room. She was coding back to the OR. They left her stomach open. She has about a 2-inch wide incision from her breastbone down to her pelvic bone, all the way down. They left her stomach wide open. She was too fragile to go down to the OR, and she had 25 surgeries in the pediatric ICU in a 5-week period. And they took out 70% of her intestines. We thought we were going to get a colonoscopy bag, but she's such a fighter. She's such a fighter. And they told me she'd never eat, she'd never drink. It'd always be tube dependent because she has basically a non-functioning, non-existing tongue. It's about 1.5 millimeters wide, and the anatomy in her mouth is completely different. So it sits way in the back. She had a hearing aid, and we had ear surgery, and by the grace of God, that's gone away. She was decannulated. But the thing is that every minute of the day, you lose who you are because your whole responsibility is your child. I gave up my corporate career, but I don't feel like I ever lost anything because that's my daughter, that's our child, and that's our responsibility as our parent. But a lot of people in my life decided, I'm not going to deal with this. I don't want to deal with this. And they would just leave my life because I'm not going that's way too much for me. I mean, even people very close to me were like, I couldn't handle this if this was my kid. I couldn't do it. And parents that are really truly loving their kid, they don't see it that way. But you lose a lot of people in your life, you lose yourself, you lose who you are, you lose your way about yourself because everything is like with her, she has a swallowing aversion, so she can choke on water because her airway's so small. So you have to watch her intently without her realizing it and making her self-conscious. She had epilepsy back then. So I had to always make sure everything was safe if she fell and dropped down and had a seizure. So these were all things that you had to implement every minute of life. And you're always on high regard because you're wondering on the what if. And if that high regard comes off for even a minute and something happens, you'll never forgive yourself. So all of the settings on the apnea monitor I set even higher because I have hearing impairment. So I set it up even higher, and I'd have even the baby monitor like right at my head, and when she was asleep, and everything you have to do, your whole world changes. 1,000%.
Well, yeah. I mean, you went to, I mean, hypervigilance times
Absolutely.
100.
You know, you go into a doctor's office and you say, I can't sit in here with kids that have a cold when you have a tracheostomy child because they could get RSV. I mean, their immune system is suppressed. So you can't do that. And then there were so many times that I would go to the ER and they're like, the ER doctors don't know how to handle a tracheostomy change. Or they're like, I don't know how to do a trach change.
Well,
That
so along these lines, you've had to not only be a mom and give all that love that you is innate with being a mom, but you've also had to learn all of the skills and thrills that go along with being a
caregiver.
doctor.
Medical home, a medical home. We're medical
Yeah.
homes.
Yeah,
Yeah.
and you
Yeah,
have to
yeah,
keep
Yeah.
right.
everything sterile.
Well,
When
and
you're in the NICU, you have to be, they make you get trained on everything for 24 hours. The nurses are outside in the station and they'll hand you the medicine, but you have to handle every situation by yourself without medical help before they'll discharge.
Yeah.
that's actually pretty amazing, and I'm glad
I
they
think
did
it's brilliant. I think it's
that.
absolutely
Yeah.
brilliant and it should be done.
Now, Beck,
Yeah.
last time we spoke, you reminded me that you were brought up in a home as a younger sister, but with a family that was constantly in caregiving mode as well. I totally forgot about that until
Yeah.
you mentioned it last week. So your story is certainly drastically different than Victoria's, but you come from a place of experience as a caregiver, experience with special needs, and I wonder if that influenced your decision to become the mom that you are now, and you could tell if you could tell the folks that story about G and that
Yeah.
whole history.
Yeah, so it's interesting, like in our 50s, I think you were sort of coming to terms with a lot of like why we are the way we are. I don't know if that's happening to you, but it's happening to me like so much now, especially because the three big kids are out of the house and I'm just having these like reflective moments and stuff. And I'm just sort of realizing like what impacted me when and why. And so being the younger child, the younger sibling of so my sister is profoundly disabled, non-ambulatory, nonverbal. When she was born, microencephaly, so her brain never fully developed. It's small. And so at 60, she's almost 60, and her IQ is that of like, an 18-month-old. So she can respond to basic things, and she has basic joys. I mean, she definitely has a quality of life and recognizes and gets excited when she sees my parents, and a little less so when I'm there because I like take attention away from her, and definitely not when my kids are there. Like she does not like my kids being around, because they take attention. But growing up, it was interesting because like I have now started to think about, and I was reading. Do you ever listen to Gabor Mate or read him? He is like he's a doctor who has started to do this like trauma research, and how he's looked at individuals that have had trauma like in the past, that how it's impacted who they are as adults. And so like what's really interesting for what I think for me, and I don't necessarily call it trauma, but I for what me, but like in my world, because I was the younger child and my sister was so needy, like so needy, and she was sick and she cried nonstop and she had grand mal seizures and she was, all of these things. There was very little, not, and this is not an indictment of my parents in any way. There was not a lot of focus for me. And so I think from a very, very, very early age, I became a self-soother, or I became a person who was like, I'll do it. I'll get it. Like, you kind of like become, and that is so fitting with my personality now. Like, no, 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 I got it. Like, I got it. Like, no, 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 I'll do it. I'll do it. I'll do it. Like, and everything. I don't want to inconvenience anybody. I don't want to like, I just want to like, plow through, get it done. And like, even if it's at all cost to me. And so I think that has been, and then you add to it that like my parents were, my dad was very strict. And so all the pressure was on me to be successful and to have this extra pressure on me and stuff. So like even going through, and I mean, I don't know if you remember like in high school, how much trouble I used to get in. And I was like constantly grounded in high school. Like all the parties that we went to in high school, I snuck out to. I must have seen Ghostbusters like 30 times because that was the only thing I was allowed to go to do is movies. But so it was just this extraordinary pressure. And so that really shaped who I was going to be as a parent. But it also shaped, I mean, so my sister was placed when we were like, she was just about 10 when she was placed because it just became too difficult. And the supports back in the 70s were very different than what the supports are now. Like now you've got like the Katie Beckett waiver and you've got like programs and things that can support families keeping a child at home. Or, cerebral palsy in a lot of kids is based on some kind of medical malpractice. And so there's a settlement or something that helps support. My parents didn't have any of that. And not only did they not have that, they didn't have a culture that supported that. I think my grandfather, my dad's father, told my dad in the hospital to just leave her there. Like, don't even bother taking her home because she was like of no use. And so, my parents were never going to do that, but that was the attitude, right? Like that was the perspective. And so all of that sort of shaped who I was kind of coming up. And then when she was placed, we spent a tremendous amount of time, like weekends were spent going back and forth to see wherever she was. We would spend an entire day like going and visiting her, or like, she would come home for a while or weekends and stuff. But it got very difficult because the bigger she got, like, the harder she went, and the older my parents got, the harder it was to manage her. And so that has sort of evolved over time as well. But I think from going to group homes and, institutional settings and stuff, because she was in an institutional setting before they started to deinstitutionalize and go towards that self-directed model. I spent a lot of time in my youth growing up on weekends in and among, people that didn't look like our friends in school,
Right.
And so I think I had an inherent sort of like, I don't know, capacity or no choice, and it kind of directed me in the way of that. And so then when it came to practicing, then I went to law school, and when I got out of law school, so, I had Matthew when my second year of law school, and I graduated 9 months pregnant with Jack. And then I was sworn in 5 months pregnant with Emily. And then when I started when I was going to practice, I'd been a paralegal. So like, I was just like trying to keep my foot in the door because they were three little kids. I mean, they were babies, And so I started to do some probate court appointment work, and that sort of led to, I met the partner that I'd worked for. And in one of the probate court appointments I had, there was a young girl who was placed at St. Vincent's Ferroletto School in Trumbull. And after Emily was born, I had to have a radical hysterectomy. And so I just felt like I was supposed to have four kids. Like I just always felt like I was supposed to have four kids. And I just was like, and then I kept saying to my husband, and I'm like, I think I'm supposed to adopt a special needs child. Like, I think that, like, I just think that is, I'm not complete. Like I don't feel like our family is complete yet. And I don't feel like, I feel like there's a child out there. And oddly enough, one February morning, I don't know what came over me. And I looked, well, divine intervention is what I think came over. And I was on the DCF website, and they had just posted this heart gallery, and it was these special needs kids that had been in the system for a while. And I saw G in this picture, and I knew where he was because I had a client that I was the guardian of that was at that facility. So I called the director, and I'm like, Tammy, I'm like, why didn't you tell me? I've been talking about adopting. She's like, oh my God, I never put it together. And so within like 2 weeks, like, we were doing home visits, and we had the whole thing, and the kids were like bought in, like, immediately. But then we had the whole system to go up against, because DCF, the system is very skewed and just designed in just a kind of a wonky way. And so ultimately when he came home, he had spent the majority of his life at that point, he'd spent about 3 full years in a hospital.
Now, how old was he at the time?
He was about 6 when he came home.
And how old were your other kids?
So
Teenagers?
Emily was just a little bit, is only about 8 months older than him.
Oh,
And
okay.
Jack is 2 months older than her or 2 years older, 18 months older than her. And then Matthew is 2 years older. So
Okay.
they were all like the pocket. And what's funny is like, if you look at Matthew and Emily, they look just like my husband and they make sense. And then if you take Jack looks like me, but doesn't look like them. But then when you put Gannon in the mix, he makes them all make sense. Like everybody fits all of a sudden. You're like, okay, oh, right. Like you would never know that he wasn't biological.
I never knew that was his real name. That's a cool name. I like it.
Yeah. And we had the whole, but when he came home, I mean, he had, you were talking about like, in the ICU and the NICU. I mean, we had to have a whole masterclass on all of his issues because he has VATER syndrome. And so VATER syndrome, when it is a constellation of issues that when they present at birth, they call it VATER syndrome. So V is for vertebrae, AT is for, he had a T fistula, which is a hole between his trachea and his esophagus that had to be repaired. He has hydrocephalus. So he had a shunt, well, he still does, has a shunt through his ventricles. He's autistic. He's just like a host of things, pulmonary issues. He only has one kidney, like all of these things, and has a lot of had a cleft palate and has a lot of anatomical, malformations, kind of like of the anatomy in his ears and his mouth and stuff. So there were a lot of things that were not stable. There were a lot of emergency things that were done when he was first born, and then when he came home to us, like, there was a lot that was not, because he'd been living in that hospital setting, which was a really interesting thing. And Victoria, you probably like know this thing. When you take them home from the hospital, there are so many things done. And then you're like, well, we don't need that. Like we can take them off of that. Like we can take them off of that. And like, I'll take responsibility for that. And then when you're doing that, when you're taking them off of that stuff, you're also creating like, so I could do a full respiratory therapy. I had a vest. I had all of the pulmonary stuff, anything you could do in the hospital, I could do at home. Mm-hmm. And we had a G tube. We had, just like feeding, the feeding tube and stuff. And and we were interviewed one time on I forget, like some news channel, and they were asking like the kids like what they did. And if you listen to Matthew's interview, and he's like 10 at the time, and he's like, yeah, I feed my brother, I get him off the bus. Like you would think that like we all did nothing, that he like did the whole thing, which is kind of funny, like their realities around it and stuff. But we've had like super horrible long hospitalizations. We end up in the hospital because when he gets sick, he gets really sick. And he had a shunt failure. And so when the shunt fails, like what it does is it stops draining. So really it's just a tube that sits in the ventricle and goes down, and it pipes around into his stomach. And when it backs up,
the ventricle in and around his brain.
In your brain. Yep. And then, so what it does is it drains the VP shunt is a ventricular peritonitis. So it goes into your peritoneum, which is like the sac that holds all of your guts. Like, so it's a sac where everything fits. And so the tube goes in and kind of loops around there, and it's long enough so that as he grows, it kind of like grows with him. And so he had one shunt failure, and sometimes they fail. And, it's not like, it's not a dramatic thing when it fails. It's sort of a progressive thing. And then it gets sort of dramatic, like as it's really done. So it's kind of like, because he's autistic, you don't really notice like what's going on first. And then all of a sudden you're like, like, 2 and 2, like that's 4. Like, you start kind of like piecing it together. And then by then he's sort of like in crisis. And so we had this one shunt revision that was done in January. And we were supposed to be going to Florida just on a vacation to see my parents. They were down in Florida. And it's like this nasty neurosurgeon was like, he's fine. Like, you can go, just take him. He's fine. Like, stop overacting. Kind of like, Mom, stop overacting. And I was like, I was like, all right, like, I don't think I'm overacting, but like, we're going down to Florida. And like, and anytime he had surgery, we have to have like a special thoracic doctor go in because his trachea, he couldn't be intubated easily. So there was all these like certain protocols and stuff around that. And like I was constantly having to explain like, no. And like back then I knew exactly like what tubes and what like microfibers and things. And I would take out this report and say like, no, you need to follow this doctor's like intubation. Otherwise it's not going to be successful. And we're going to have to go back and like start all over again. I'm like, you're going to hurt him. And so it was constantly that fighting. So this one nurse, this one procedure. So they do it, and I'm like, he had like an infection, what looked like an infection in his belly where they pulled the tube out. And I was like, that just doesn't look right. And everybody was dismissing me. And I was like, and I didn't trust my gut. That one time I didn't trust my gut because we were supposed to be going to Florida and we were just going down. We were just driving down to see my parents. And so it wasn't even like we were going down for any like big like wedding or anything. So we totally could have stayed home. But I like overrid my gut and we went down. And by the time we got to Florida, he was like not right. And I would hooked him up to a G tube feeding that night. And I was like, I took a conference call and I came back in and he was like moaning. And when, autistic kids often don't report pain very well, like it's sort of like you have to look at other body responses, like elevated heart rates, or, he doesn't really even spike a fever. Like, so you have to really pay attention to behavior in autistic kids a lot of the time. And so I'm like, he's just not right. Like, this is just not right. And then he kept wanting to go and sit in the bath, which was very weird. Like the fact that he wanted to go sit in a bath, like was completely. So fast forward, turns out that he is septic and we had no idea. So we were in Jupiter, Florida, and I had been on the phone back and forth with a pediatrician like all night. And I was like, what do I do? Because anytime we traveled, I always traveled with my binder of all of his like hospitalizations and stuff. And I knew where hospitals were. Everywhere we've ever traveled, I've always known where hospitals were. And so I was like, there is the Orlando Children's Hospital or there's Miami Children's. Like, where do I go? Like, both were like an hour and a half away, 2 hours away. And the doctor was like, well, I just heard that like the neuro staff at Orlando has like just changed over. So I don't know, go to Miami. So I'm like, so we literally get in the car because I'm like, I'm not calling an ambulance because I thought they're going to take us to some walk-in, like, so Mark and I get in the car. We leave the 3 kids with my parents and we are like racing down 95, 2 hours. He is screaming and writhing in pain at this point, which is so absurd because like he never does that. We go run, basically like jump out of the car, leave it in the driveway of the emergency room. And I was like, I have my book and I'm like, he's 2 week post, shunt revision. He's so beyond baseline. I don't even recognize him. They take us back. Like a resident comes out to look at us. And I was like, I don't want a resident. I don't want to. And he's like, nope, got it. Get the attending. They take the attending. And during this, my phone is ringing off the hook with like the doctor's office is calling because the pediatrician is like, holy cow, like, what's going on? You're 1,000 miles away. And like, we have no touch. And I'm getting phone calls from work and like all of this stuff is going crazy. And my husband is like trying to manage the other kids because we left in such a crisis. And so we get in and they just do an ultrasound, all septated fluid in his stomach, which means like he was circling the drain. Like, and that's what the neurosurgeon said to me. And I'm like, so I walk out and the neurosurgeon's like, we have to take him into surgery right now. And I'm like, I'm like, I don't know you. Like, I don't know you. I'm not okay with this. I don't know you. I'll fly him home. And she took me by the shoulders and she said, listen to me. I know you don't know me. And I don't know you. She said, but if you walk out that door, you're going to take a dead body home. And she said, just like that. And I was like, okay. It was like, all right, what do we need to do? And
let me slap you into
it was like, you're taking a dead body home. And it was like those words, like, and you could not have penetrated my brain with anything other than dead body. Like, and so he ended up being, he and I had to stay in Miami for about 7 weeks. And Mark and the kids had to go back home because, they had to go back to school and work and everything. And like, I literally practiced law from I did a probate court hearing, an emergency probate court hearing in the nurses station in ICU in Miami Children's Hospital. Like I like couldn't miss, I didn't have the luxury of missing a beat, you know? And
Well,
he had four
but
brain surgeries in that period of time. And what happens to him is, and I'm sure, Victoria, this happens to you, like you get sick with one thing and then you get a super infection of another thing. And I kept saying, like, he's going to get pneumonia. Like, we need respiratory to come in and consult. And what was really cool is the doctor said, the infectious disease doctor during like their rounds said, listen, this is a learning experience for all of you. He basically said, and he was very attractive, this infectious disease doctor. And he
well,
said,
if you're going to be an infectious disease doctor, you better be attractive.
totally. I mean,
Yeah.
he was really quite striking. And he said, listen, and it's not just because he gave me all this cred, but he's like, when a mom of a special needs child tells you to do something, you do it and you don't question. And I thought, and I
Wow.
was like, thank you. I was like,
Good
oh
for
my,
him,
I'm
right?
like,
I mean,
finally, like, thank you. And so that
That's not
respiratory,
normal.
no,
no.
that
And you
is
know
like,
something?
so
And
yeah,
that's something that Victoria talks about very often when she gets going,
Burnout.
like you get going.
yeah,
She talks about that a lot, is about listen to me. I know what the hell I'm talking about. And
right.
I say that all the time too.
Yeah.
Include the family here. The
Oh my
family
God, right? Yeah.
has so much history. I mean, even for well, all of us, even for our own medical. I got
Yeah.
questioned one time when a medical student was questioning whether or not I had an ear infection. I've had an ear infection since I was like 2 years old.
Yeah.
And I
Yeah.
said, dude, I have an ear infection. Anyway,
Yeah.
this
No,
isn't about me. This is about the dynamic work and thank you both for Jesus putting up with and putting resilience to go through all of this stuff. I mean, you brought up so many things that I want to talk about that we probably don't have enough time to talk about in one episode, and we might have to have another part two. But one thing that you brought up from your perspective, Rebecca, that's always been a concern to me and something that I want to talk at length with, if there's anybody out there that's listening that is a specialist in this and has lived experience in particular, is the impact on the siblings in the home.
yeah.
I think that is a huge undervalued and understudied, maybe even underappreciated group of people that should have a voice too.
It's
You,
funny that you say that because last weekend, I literally wrote an article for our summer newsletter for the firm's our department's summer newsletter about the other child in the room, the role
yeah.
of the sibling in special
Well, you
needs
should
clinic.
get that over to us so we could get it out there and
Yeah.
publish it to our
Yeah.
tribe too.
Yeah,
And
because
the other,
it's so important because I think too, like to that point, the kind of what I was trying to say in the article and something that I talk about a lot of the times when I'm meeting with families is like, don't assume that that the siblings want to take on a role or that it's fair that you expect them to take on a role. Like, so like ask, it's a completely appropriate and right to ask them if they want to, but like with no judgment, like literally, I don't want you to feel left out of this, but I don't expect you to want to
well,
do this, you know?
if you look up one of our holding it together kind of podcast conversations, Rebecca goes into detail about the conversation that she had with her adult kids about this. And
Mhm.
it's really impactful. And it's really important that that conversation does take place. It's very important. Now, listening to the two of you moms talk about the raising of your children, it almost seems impossible for me to even go to this next question. And knowing the two of you, I pretty much already know the answer, but I'm trying to put you into a place where you could imagine other scenarios, other caregivers who may, part of the burnout from caregiving, part of the initial symptoms, if you will, of the burnout of caregiving, I think has to be the idea of I'm feeling guilty because I'm not enough,
Mhm.
or I don't know enough, I can't do enough. I'm feeling guilty because from time to time I resent having to be in the position that I'm in. I feel guilty because my life is dedicated around everything to do with the child. And I basically now my identity has become that as opposed to anything else. Now, again, I know you two very well, and I know that it's very hard for you to imagine your life as anything but this absolute dedication that you just so brilliantly laid out for everybody. But Victoria, can you see and can you relate? And have you personally had any experience first? And can you see alternatively, can you see and relate to why people would have those feelings and how to maybe approach that?
That's a yes. I've never had that. My daughter Faith has been like she does fundraising every year, and since she was 4, and we raise 200 to 300 toys. And every year we go to the facilities, and like if there's a little boy or a little girl in the bed, she would say, "I have a bad memory. I don't remember which one you want. Pick one." And if there's a sibling in the bed, she always says, "Hey, by the way, your brother wanted to give you a gift. Pick out whatever you want." And she'd always say it was from the child in the bed. I've never had that burnout. I've always just, because I'm so lucky to have her, and we weren't supposed to make it. And like being that I'm in the hospitals like I am, and I advocate for special needs families, and I do see parents, and I do see a lot of the siblings, and I always try to make time to talk with the siblings and, try to interact with them too, because they're just sitting there a lot of time on their phone or their device, and they feel like they're forgotten, right? And I'll bring activities to do for them that's fun and interactive with them. But I see a lot of times, a lot of parents, a lot of marriages end up
Yep.
divorce. It's huge. Marriages do not stay intact when there's this kind of situation.
For sure, we were talking about the impact on children, and that's another thing that should be studied is the impact on relationships and
Oh
family.
yeah.
And
Yeah.
I know that there's much more literature on it than that, but sorry to interrupt, but go
No,
ahead.
no, but I've seen it a lot. A very dedicated, for the most part, men leave. That's not, that's the fact is that most of the time the men leave. There has been plenty of time where it's been very hard for me, especially because, Mike, you know me, it's very hard where I get called and asked to be the advocate for this child, and I'll go in and I see a mom that's just like, she's ruined my life. He's ruined my life. And I'm just like, or how can you be that way? I can't do this anymore. I'm burnt out. I just want to go to a soccer game. I want to go to a ballet game. And I'm like, and you have to maintain your professionalism at the same time you're inside going, what the hell's the matter with you? But they do get burned out. But
But
you
that's a
have to be
tough,
able to,
that's a tough
that's
thing.
why you can't say anything. You have to
Well,
just go
right. I mean,
in.
everybody has their own journey in this.
Absolutely. But I mean, like I say, I go in there and I maintain my professionalism, but it's like, let me see if I can help you de-escalate this stress level that you're in by implementing some things you might not know you're available for, like the Katie Beckett waiver. Let's see about getting you in some extra activities, or see if you can get respite care, or let's see if, because most people don't even know about respite care, or let's see about getting you a nurse part-time, because you should qualify for some kind of helpful nursing. So maybe you can even take a couple of hours, go to the grocery store, or go to sleep, or do something. These are things that you might not realize that you have available to you. So let's try to make it better for you. And you try to like make them feel better about it. And then you try to I try to do things that kind of bridge the gap with the child and the mother together too. That helps. But it's tough. And especially because most doctors, even in an emergency situation, and you're coming in with your child, they don't, either they love a special needs mom or they hate us, because we will not put up with their crap. Like we will go over their head. Like when we were in the children's hospital at one of them, it was a teaching hospital, and they would walk in with like 9 residents, like it's
Oh.
flipping Grey's Anatomy, right? And
Oh.
they'd be like, "Oh, here is Faith, who's 6 years old, who presents with da, da, da." And I'm like, "Stop,
Hmm.
outside, outside."
That's why I give my spreadsheet, because I'm like, don't come back and ask me a question that's on the spreadsheet. When we came back from that, I don't mean to interrupt you, but I'll tell you what I can tag onto that story. We came back from the first follow-up appointment we had with GI when we came back from Miami, because I had to go to each specialist and give them an update. It was just at the turn of the interns, and they sent in an intern, and she looked at him, and I tried to explain the story, and I was like, I'm like, with all due respect, I really would rather not tell you this story. We have just been through it. Like, I said, I would rather just talk to Dr. Pashankar. Like, can you please just get him? She's like, well, let me just take notes. And I'm like, fine. I'm like, literally, I was just like, fine, fine. So she looks at him, she looks at his G tube, and she goes, is that his shunt? And I'm like,
Out, get out.
and that's exactly what I said. I said, that's it.
Get
I said, that's it. I said, that's it. I said, if you do not know what a shunt is and what the difference between a shunt and a G
feeding tube.
I'm like, you have bigger issues here, and I want the doctor. So I was just like, yeah, that was one of those moments where I'm like, nope, nope, nope.
I hope that some of you people get to watch this in video and see me hiding under the desk right now.
Well, we had a whiteboard, and like the people would come in the room, and I'm like, I'd go out, and we'd walk out, and I'm like, listen, let me make this very clear to you. She's not a case. She's not a patient number. She's not a file. It's not, let's see what we can get from the insurance. That is my kid. This is red hair. This is the line. Don't cross it.
And by the way, she can hear you.
Right.
By the way, he hears everything you're saying. And I think he would probably not want to be referred to as a case or a number. Like, he gets it. You're talking about what you're going to do to his body. So, why don't you talk to him about it?
Right.
Oh, I get so furious.
And they just want to come in and they're like, oh, well, this is such a great learning case. I'm like, say it again.
Right.
And then I was like, do you know who Dr. Talley is? And they're like, I'm like, yeah, he's the CEO here. I have his personal cell phone number. Do you want me to call him right now? Because I just got out of the elevator with him yesterday. Go ahead and do this again. And they're like,
every time we get talking about this, you guys go right to freaking nastiness. I'm just going to
kill. That's our child. That's our baby.
Nasty. It's not nasty.
They deserve it.
It's zealousness because for every one of us, there are 100 of women or parents that are just getting pushed aside and are getting ignored. So if we can show you, like, this is how you treat, and I'm always very respectful. Like, I don't get mean. Yeah, I don't get mean.
Is it? It's just me that brings this side of you.
No, they get the utmost respect until you cross the line.
And it's two mom shit with similar experiences that are like, you're seeing the mama bear coming out of both of us because, like, that is like, yeah, I am very gracious, and I will give, like, I will validate, like, I know how hard this is. I know there's a lot going on here. I totally respect what you do. I also will do, I'm always like, when he's hospitalized, I'm always like, don't worry, I will change his bed linens. Like, I will do the diaper changes. I will do the G-tube feeds. I will do whatever you need me to do. You don't even have to think about his hygiene issues. I will take care of that 100%. You know, like, I'm like, you don't have to do any of that. You just have to come in and do his meds. Like, whatever I can't do, you do.
But don't be late bringing my kids' meds.
Right. Like, don't make him in pain. Yeah.
I have a confession to make here to everybody listening right now.
He's scared of it.
I wanted to do this podcast. I thought this would be a great idea. And right now I feel like I'm really in the piranha pool.
No, but see, that's the thing. It's like, you know, like they told her, and I know she'll get it. They said, Faith cannot walk the floor. Why? Because she can't sit in this bed. We've been in this room for a month. So, okay, guess what we're going to do? Get the IV pole, right? Get her cute your little slippers on. I put her slippers on. I get her on the IV pole. She was teeny tiny. Like, she's still teeny tiny. Mm-hmm. And I put her on the IV pole. I took my robe and wrapped it around her, took the robe tie, wrapped it around the IV pole, tied it. And we were walking that. And I was like, she ain't touching the floor. It's all about how you write the report. It's like, she ain't touching the floor. She ain't walking the floor. She's rolling. And we would go get candy for all the nurses. And we would say, thank you for what you do. How was your day? How is your husband? Oh, you're planning a wedding. How's that going? And we treated them like human beings. Now, if you did something like, oh, is that a shunt? And that's my kid's tube. They are not going to want to come in the room.
Right.
They're
exactly.
Not.
Exactly.
But we have nurses that will fight to get us when we go in. They're like,
I still have nurses from hospitalizations that I'm friends with on Facebook that, like, I've kept up with from 15 years ago. Like, absolutely still friends from hospitalizations and follow them. No, absolutely.
Jeez, all I had to do was go to keg parties with you.
That's right. Can't even do that anymore, right?
So, all right. So the conversation regarding those emotions that I laid out before obviously needs to be reserved for another time with another couple of people, because you guys are definitely not there. And that's great. All the power to you, because you are strong and you've overcome that. But I do want to acknowledge that the reality of a lot of people is the the resentment, the guilt, the overwhelm, and you two have certainly taken this by the throat, but and that you can share or not share stories of overwhelm, but and how much is career and things like that
Oh
too.
yeah. But I would say
Um,
I would say I would differ from Victoria a little bit in that I definitely am burnt out. Like I'm definitely, and I don't know, I mean, I'm burnt out from it all. I don't know that I have a resentment towards anything in particular. Like I wouldn't say that I have a resentment about things. I don't think that's the word I would use for what I have, but life at this that it's like I say like my nervous system
you're
is
afraid.
yeah, it's like I I row, I'm on a rowing team and like I don't want to compete right now because my nervous system is so fried from all of these things. Like it's now I'm looking back and I'm like, God, I'm just like I'm like fried. And so I need to like let my nervous system heal. So it's not like resentment because I never resented anything about him or any of my kids, but like overwhelmed and overwrought and just stretched, like that's the feeling that I have, and just like that constant like at me
Well, at
feeling.
the same time, you're caring for these high needs kids. You're also doing a lot of highly impactful work for other people who are in need. And there's something to be said not only about you as the heroines that you are, but about, I wonder how much of that feeds one or the other. Is it a chicken or the egg?
Totally.
What is it a reason I do this work because of where I come from, or I come from this because of the work that and vice
Yeah.
versa.
Oh, I had a judge, one of the first judges that I worked for, in Judge Creme in Stratford. He said to me, he nailed me early on. He was like, "You have an overdeveloped sense of responsibility towards everything."
But I could see that from when you were a child,
Yeah, no, for sure.
with your
I've
with
had
your
it. I've had
sister.
it. I was always gonna be
Right,
this, no matter what I did. And so,
right.
so that's a,
Well,
a
and
reflection,
and Victoria's taken it to the level where she's made a movement out of it to really give a voice and strength to, you know, other women who have gone through the horrific events that she went through. I mean, so I mean, not only is her story horrific on the level that with the abuse that she sustained, but then it's heroic on the level of what she's done for her
Yeah.
child and what they've overcome together.
Was she
I
was
was
Faith born? She was born prematurely because of the abuse.
Yes.
That's like
it's
unbelievable. Yeah, that is. I mean,
unfathomable.
your
Yeah.
story is a whole nother level of
It is, and and
intensity.
and and yours is too, and neither one, is everybody's on their own journey. That's why I said, I know perfectly well because I've spoken to these women, and well, not just women, men too, who have that resentment and that guilt feeling, and I just want people to know that it's okay. But to Victoria's point, let us help you get some tools,
Mhm.
and in your diatribes and yelling at me about this just now. You both came out and said, "Look
I'm
at this
yelling at
one
you.
position." No, but when you guys were emphatically speaking your stories, you threw out there some things that I think can be translated into useful tidbits and useful tools. So I want to go back and forth and just say, okay, so Victoria, in a quick couple sentences, what's one good workaround that oh, I know one that you told me about, but I can't remember exactly what it is. What's a good workaround that no, it was Becky, it was Rebecca, sorry, that told it to me. What's one good workaround that you would offer to parents and not only just parents, but any kind of caregiver that you've learned and you would want to impart to them?
I was pretty sure I thought you were going to talk about the paperwork. And I tell this to people all the time who are frequent flyers. I mean, we were in the emergency room at least once, if not twice a week for a while. And so that was with inclusions of trachs and coding and things of that nature. And so I said to the parents, I've said this for years, that you go in there and they give you a bunch of paperwork and they're like, we're going to go ahead and take your child back and you fill out the paperwork. I'm like, yeah, I don't think so. So
Mhm.
what happens is I'm like, my insurance card is not changing numbers before I get into triage. So it's fine. So what I've done is I go in there and I'm like, can I get an extra set of papers? I've messed this up. Right. And then I just kind of fold them up and put it in my bag. And then I go about my business and I fill it out. So when I get home, I fill it out and leave a couple of spaces of what brought you in here today. And then I fill out all the rest because the forms don't change. And then I put them in my emergent bag, in my to-go bag. And I probably had like 30 copies because we were there so frequently. So people can do this. Just go in there and say, I messed up. Can I have another set of papers? So then when we would come in, either by ambulance or, I would drive her in or whatever the case may be, and they're like, oh, here's your paperwork. We'll take you back. I would just put it on the counter and say, I'm going with her. Because then, they give you 50 stacks. And then they ask you on the back, like, they give you 3 lines. Tell me how many surgeries she's had. Where do you want me to put the rest of this? Or what are her diagnoses? Or, has she ever had blood transfusions? Or list her hospitalizations. And I'm like, I can give every one of them to you by memory. I can give you her doses of medication. I can tell you if they're BID or Q4 or whatever the case may be. I can tell you. And they're like, well, you need to write it down. None of y'all read it anyway.
That's why I say see attached, and then I give
That's
them
what
a
I say
5-page spreadsheet.
on file.
Oh, that's good. I was going to say, okay, so it was you, Victoria, that told me that little tidbit about
That was
stealing the
mine,
forms and just
on
having those.
file.
So I thought it was Rebecca, but Rebecca also does something that I highly encourage people to do, and you were just alluding to it. Go ahead, Beck.
Yeah, so I have everything that Victoria was just talking about, surgeries, like diagnoses, like major surgeries, major med changes, because I don't want some doctor telling me that like, oh, we're going to put him on rifampin. And I'm like, he had an allergic reaction to rifampin. Like, I don't want to try anything that we've already tried and failed. So like, that's why I put it all there. And, and I even have a little YouTube, a private YouTube link that shows his baseline, because like, if you look at him and he's sick in the bed, you don't know that he talks and that he walks and that he can do these things. Like
He
you
sings
read.
dirty songs.
Yeah,
You like to sing,
exactly. Yeah.
you like to
You,
sing dirty.
yeah. And so like, you don't know what he does or who he is, especially because when you read his diagnoses, you think like, oh my gosh, this kid, like,
Yeah.
can't move. And, and he very much can do lots of things. So I think having that spreadsheet, it also takes out all of that like frustrating talk that Victoria was just talking about. Like, oh, I can't tell you how much that that just turns my stomach when some young doctor starts asking me like what surgeries has he had. I'm like, he's had so many surgeries, that's why I gave you the list. Like, look at his body and you will see he's a wounded warrior. Like he has stitches, he has scars from the top of his head down to his toes from all the things that have been done to him. And so if you need to know that roadmap, like, then look, it's there.
Well, and Victoria's brought this up in several conversations we've had on this podcast and on my podcast and other people's podcasts that we've been guests on. It's maddening that they're not reading what you're giving them.
Yeah.
Or they're not reading what's on the wall that they put there
Yep.
to.
But I send him back out, won't answer the question.
So if you could,
yeah,
if you could just really, and we don't have much time here left, I just really want each of you to take, just a minute or two and just talk directly to the parents that are, currently feeling like they're imposters because they're not doing it right, or they're feeling the weight of all this, or they're not stepping up because they are intimidated. It's an intimidating thing. Victoria, what would you say to them? What would be some advice that you would give to them about that courage and where to get that strength from?
I would first tell them to take a second and take a deep breath.
Yeah.
Just take a moment and take a deep breath. And remember, and I say this so many times, that beautiful child that causes some people stress and frustration can still wrap their hand around your pinky, which is how they told you that they loved you the first time. And they still love you, and you're their voice, and you're advocating for them because they don't know what's going on. And they are more afraid and more scared than you are right now. And if you have that mama bear gut thing going on and you're questioning something, go with your gut, follow it, test the doctors. I mean, where do you come up with this? Why are you coming up with this decision? Why do you think this needs to be? If you think that they need a CAT scan and they're like, no, I don't think so, push for it. And if they say no, go to someone else. You know, you can ask for whoever's on call to come down. You can push for the specialist because, you know, you could say, I'm telling you right now, I'm not prepared to take my child home until X, Y, and Z is done. And I'm not prepared to release you of your liability because you're not doing what is best interest of my child.
Yeah.
That's powerful. How about you, Beck?
Yeah. So I think that everything that Victoria just said, absolutely. And then I would
Okay.
say,
That's it. You're done.
yeah, that's no, I'm not. I'm never done.
No,
No, you know me better than that, Michael. No, I think I would say that like you make the best decisions that you can in the moment, you know, with all the facts that you have. And, you know, sometimes they're perfect, they're great decisions, and sometimes they prove out to be a little bit, but you can't beat yourself up over them as long as you do it with the best, trust your gut and make the best decision that you can in that moment. And then don't regret, like, because that doesn't get you that regret gets you nowhere, you know. And then I wanted to add one other thing, kind of like looping back a little bit, but when we were talking about partners, and I think one interesting dynamic in partners in a parenting, Victoria, maybe you feel this too, but like it's natural for one of the partners to own the care and the other partner to be the backup. And I don't think you can have two be completely owning of the care because it's like not possible. Like somebody has to own it. And so my husband is really good at like taking him to a doctor's appointment and asking questions or doing certain things if I set it up. But there's only certain things that I have him do. And it's not because I don't trust his ability or his judgment, but I have all of the clues. I've had all of the pieces. Like I know them all. So something might trigger for me that wouldn't necessarily trigger for him, or he might forget to report something to me that somebody said off the hand. So it's okay for one of you to own it, like the picture, and the other one to take a backup. It's not a question of ability at that point. It's a question of like how to get the best care. And it's really
Oh,
important
that
to,
goes to teamwork and
yeah,
understanding, right, the hedgehog principle, what you're really good at and what I'm really good at, and
yeah.
let's play upon each other's strengths.
And not
Um,
criticize the other one and not
right.
make the other one feel like, because
And
I
not
think
resent and not
yeah, because I
resent.
think Mark would
And
get lost in that sometimes, like, you
that's
know,
hard. That's
like
hard,
I
man.
can do this too. And I'm like, this is not a statement about whether you can do it. I absolutely know you can do it. You know,
Yeah.
it's just a question of like, this is so complicated and I've got it all like in my head and written down and organized. Like it's just easier, like if we feed into this model already kind of thing and not, you know, and it again, it's not like an indictment or a challenge to your credibility. And I think that when you can validate that and say, like, you are hugely supportive, like in so many other ways, in so many ways. You just don't have to do the direct care that I'm doing because, like, we only need one of us to do that, but we need both of us to do everything else, kind of thing. And I think that recognition kind of takes, because otherwise, I think he feels a little like not emasculated, but like superfluous in a way, like not quite, but he's so important to the whole thing, you know? He's so
That's
important.
really that's really valuable for everybody to hear too, because I'm sure, and this goes right into my what I was going to say, here comes my permission slip for everybody, right? If you need to hear it from somebody, I'm telling you right now, folks, it's okay to be tired. It's okay to feel a little guilt. It's okay to have this discussion about I can take a back seat because I know you got this, or you could take a back seat because I have this and I don't resent, I appreciate everything else you're doing. So it's okay to be angry. It's okay to be in survival mode because surviving, is also achievement and professional grade. And as both of these fantastic women have said, your kid needs that from you.
Well,
Uh,
I want to
your,
add one
your
thing.
loved one needs that from you. I'm sorry.
He's like, oh God. I want to add one thing. Never ever give up hope. And I tell this to everybody, never ever give up hope because miracles happen every single day. And I haven't been able to talk to Mike today. We talk all the time. I haven't been able to really talk to him today. But I have a huge special like announcement, and I'm really gonna like keep it together when I say it. We were told from day one she'd have a feeding tube for the rest of her life. She got rid of it at 16. When we almost lost her, she got it again. They told her she'd never eat by mouth. She, failure to thrive, the whole shebang. That she does have kidney disease now. But this morning, I mean, we used to go to gastroenterology weekly, and I was on the phone with him twice a week and then seeing him once a week. So we went today. This morning, we were there at 8 o'clock, and my daughter and him do not get along. If y'all ever heard the story about the nickname Dr. Diarrhea? That's this guy. She calls him Dr. Diarrhea. And we go in there, and he says to her today, I don't have to see you anymore. You're done. You're out of here. And she was like, what? And he was like, you no longer need a GI doctor. And she goes, are you kidding? Like in this, because we were told she'd be fed through a tube her entire life. She'd
Yeah.
never sit at a table and enjoy a meal. She'd never be able to, because she aspirated on liquid. She's had 2 fundoplication Nisen's done. She's had pyloroplasty. She's had it all done. So when we're sitting in there today, and she looks at me and she was like, thank you, Mom. And I went, wait, what? And she goes, because if it wasn't for you, I wouldn't be here today. And I was like, no, 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 no. This is a team effort. This is us. This is the 2 of us together. You're amazing. I'm so proud of you. And Faith is a little prankster. She's a little smart mouth. And she looked back at the doctor and gave him the finger and told him to eat. And he was like, I guess we'll be here if you ever need us. And she's like, we won't. And gave him the finger, and out we went. And she was like, I'm done. I graduated. I never
Wow.
need GI again. So you got to keep the hope up, right? And this was like 8 o'clock this morning. I fought Atlanta traffic for 2.5 hours to get there. And it was literally like we just grabbed each other and was holding each other and so happy, because nowhere in this journey would we ever think that this would happen, ever. And
Yeah.
then all of a sudden now you hear you don't
Wow,
need
that's
that
amazing.
anymore.
That's
Yeah.
amazing.
It's
Dr.
huge.
Diarrhea brings some good news too.
Don't get lost
So
in the
don't give
moment,
up
right?
your
But
hope.
but you know what? I will second her emotion and say thanks to you both for your radical honesty. Thanks for proving that even when the system's broken, caregivers remain unbreakable, right? And you guys have implemented your own survival tools. You shared some of them here with everybody today, and hopefully people can learn from you and be inspired by you, like Faith is, and like G is, and like your husbands are, and like you are to so many people. So everybody, thanks very much for listening to This Is What It Takes. Remember, you're not just holding it together, you're building the path for those that are coming behind you. And that includes those little kiddos that we just got done talking about. So thanks again, guys, for being here. Well, Victoria, you don't have a choice. Rebecca, thank you for being here
Roast
again.
him on another one. Can you and I just
Absolutely.
And we'll,
I can go way back.
wait?
all right, you guys, thanks very much. And everybody, good night. I hope you enjoyed this episode.
Thanks, guys.
Thank you. Thanks.
Why is it?
I'm not